Hello, Dr. Toro. This is my advanced practice nursing presentation. This is my first time recording on a PowerPoint deck, so we'll see how this goes. My name is Whitney Lorengen, and the role that I selected to present about today is the nurse practitioner role, simply because that's the track that I am taking. And I thought this would be a good opportunity to delve deeper into that. Representing the largest group of advanced practice nursing, I have chosen to follow the crowd. But even being the largest crowd, there is a federal initiative to continue to grow the number of people in this role. And this is because there is a predicted shortfall by 2025, which is next year. The way that this is predicted is varied by state, as some states may have a surplus of primary care providers, while others may be deeply in deficit. One of the things that I was proud to read about in our textbook is that NPs have a reputation of providing safe, high-quality, cost-effective care. Role definition. This role is an advanced practice nursing role, as it requires more formalized education than the ANP counterparts. The nurse practitioner role was developed due to an emerging need for primary care. Not only did it advance the nursing profession, as previously mentioned, it was also a cost-effective way to deliver much-needed help to impoverished areas. NPs can work in a variety of settings. Some of them include hospital, outpatient, and inpatient, primary care, private practices, urgent cares, community health centers, and rural health clinics. There is also certification required in various specialties like pediatrics, family, adult gerontology, women, and acute care. The NP role had a rocky start before it became what it is today. In the early stages, it was more of continuing education instead of a formal program. So depending on what state that you were in, like the NP role could look very different. And because of this, the consensus model helped to standardize certification and education for APRN roles across the United States in 2008. Some of the key elements of this model are licensure, so every NP must have a valid nursing license. Accreditation, you have to go through an accredited graduate level program. Certification, all NPs must pass a national certification. And education, all NPs must have advanced knowledge and skills to adequately provide care for patients. The implications of this are, as previously mentioned, it helps to standardize education and define our scope. This, in part, has helped boost the positive reputation that NPs have in the field, as this promotes our profession by ensuring quality care across the board. It also helps with collaborating with other professions because our role is now consistent and we have very defined roles, so people will know what to expect. NPs are licensed and have some prescriptive authority across the United States. To do this, they need a master's degree. The consensus model has regulated education and states that an APRN is a nurse who has completed a graduate level program from an accredited school, has passed a national certification exam, has acquired advanced clinical knowledge and skills, has demonstrated a greater depth of knowledge of synthesizing data, complexity of skills and intervention, and great autonomy, has prepared to assume responsibility and accountability for health maintenance and diagnosis, has had enough clinical experience in the role, and has obtained a license for that role. The NONPF has set standards for all NP tracks and specialties. An NP must hold sufficient knowledge in these areas to be considered competent to practice. These core competencies are scientific foundation, leadership, quality, practice injury, technology and information literacy, policy, health delivery system, and ethics. So in California, the requirements, every state has their own requirements. In California, the requirements are you have to hold a valid or active nursing license, possess a graduate degree in nursing, complete a nurse practitioner program approved by the board, and pass national board certification. There are many professional organizations that represent NPs. The American Association of Nurse Practitioners, the AANP, is the largest and is for all tracks and specialties of NPs. In California, there is the California Association for Nurse Practitioners, And while I have not yet decided to go in this direction, I am leaning towards women's health. And there is a National Association of Nurse Practitioners in Women's Health. There is a whole list of them, but these were the few that I picked out because they were the ones that interested me. So why is this important, or how do these organizations help the profession? Listed here are some of the reasons why this is important. Continuing education. You have access, by joining an association or organization, you have access to specialty journals and conferences. Networking and peer support. It's like being part of a club with like-minded people. Industry trends. Because you're a part of a group with similar interests, you get to stay on the cutting edge of any changes affecting your field. Career development. Scholarships or positional opportunities will likely be advertised to these groups. Even just by networking, you get to increase your chances of furthering your career within your specialty. And finally, policy changes. More can be accomplished when combining resources that can help address things like health equity and racism, which is very relevant in our field. Exploring now how a biblical worldview aligns with being a nurse practitioner. This is a quote that I found from an article that I really liked. Caring occurs at the intersection of human suffering and hope. Nurses who identify a higher power are more likely to consider their nursing profession as their calling. They are likely to view their role not just as a means to a paycheck, but one of service for a higher good. Nursing as a profession was born out of a need to help people facing social inequalities, and in modern day, it helps to promote health equity, which is what the Bible essentially teaches. What are the implications? Preventing burnout. Burnout is not a new thing in healthcare, especially after COVID. It's hard not to get burnt out when you're constantly caring for sick people. It can be so emotionally taxing and physically taxing as well. When I can view my role as an NP as a calling instead of a job I'm proficient at, I think it grounds me to my purpose and helps me to keep going. I can draw on strength from a higher power, knowing I am where I'm supposed to be. And optimal care. I think for patients, they will receive better care as well because I can view this person as God's child and not simply another number or task to check off in my day. It allows me to be more open and willing to humanize this patient. I can take more of a to-do unto others mentality. Relating Parsi's human becoming theory. The theory was originally titled Man Living Health, but Parsi renamed her theory to the human becoming theory because she taught that humans are constantly evolving, so they are becoming, not just beings. She believed that practitioners should view and treat patients from a human-focused perspective, allowing the individual to define what matters. We can all have knowledge about a disease process. We can tell a patient what they need to take to feel better. But until we learn what is important to that patient, because they are and should be considered the expert of what makes life meaningful to them, we're not really treating the patient holistically or even really effectively. One of the aspects that enhances the role of an NP of this theory that I liked, that I chose, was transcendence. I like this because it emphasizes the human capacity to change and to grow. It also provides a holistic approach. We can encourage our patients to explore the parts that give their life meaning, and when we can see our patients as active participants in their care, we are not just talking at them or doling out prescriptions, but we are working together and engaging with them to navigate their path to wellness with intention. It's also transformative. Humans can change the way they see things that are familiar to them. This promotes a person's sense of agency, and they can rise above whatever challenges they face. In conclusion, the nurse practitioner role is the largest advanced practice nursing role with good reason. The time and effort that has been put into standardizing and elevating the role and its expertise has made a big impact in how it fits in the greater medical field picture, ultimately giving the profession the positive reputation it currently has in giving good quality care. Professional organizations have helped to push policies that not only protect and elevate this role, but also to fight and care for the population that we serve. The NP role or the organization or associations themselves are not inherently religious, but by being human-focused and human-centered, it does align with a lot of biblical values. Parsi's theory has helped to define and put into observable actions how we can care better for our patients from a holistic and humanizing perspective. These all fit with my values of connecting with others and helping. I've had some pretty negative experiences being a patient of the healthcare system, and by becoming an NP, I can be the change that I would have liked to have seen when I was a patient. There is so much more to a person than just their physical challenges, and with the knowledge and skills gained from this program, I can help patients to not only get healthier, but to also feel seen and actually feel cared for. And that is it, Dr. Toro. Hopefully this worked out smoothly. Thank you.